Kyla. I'm calling from St. Mary's Home Health and the manager of intake for the home health and hospice. Is this a good time to talk?
Not really. You waited until my son was at home and he has autism.
Oh, boy. I just wanted to call and follow up. I was asked to call. It looks like you were looking for more information on why we declined services for you.
Yeah, I asked for it in writing. And I asked for a level 1 grievance.
Okay. Do you want to review it by phone as well? I can certainly get something typed up and sent out to you. I just wanted to take time and give you a call as well.
Okay.
Is that okay?
Yep.
Okay. So kind of how our process works is anytime in intake we get a referral and there's a flag in a patient's medical record indicating that there might be any kind of behavior or any concern that way, we send that information to our risk management department, who does a review to determine if it's safe for us to provide care for a patient. What happened with your situation is there was a flag put in your record from when you visited the ER on the 24th of March, indicating it's part of the screening process that the ER does, and I don't know if you recall this, but generally what they'll do is they'll ask a question. Is there a risk of violence? Is there any history of physical violence or aggression towards healthcare workers? And I don't know if you remember having that conversation, but it was flagged.
I don't have to remember that because I've never had any violence towards a caregiver, and I've never been physical with a caregiver in my life. I might be many things, but dumb is not one of them. If I got physical with a caregiver, I would have been in jail because that's what they like to do in Madison. They like to send you to jail. I went to jail for less for trying to defend myself. So there's no way I would have beat a caregiver and got away with it. It would be in my medical file. It would be in police records. And you said on what date, so I can go back and look at the notes?
Yeah, so that was on March 24th when you were at the ED.
On the 24th of?
Correct.
Of 24?
Of March. Yeah.
Why was I there for? What was I there for?
I don't know, and personally, I didn't, dig through your chart just for privacy reasons. That's something our risk management department does. We want to, HIPAA compliance and all of that. I'm not sure what you were there for that visit on the 24th.
And it said in the notes that a social worker asked.
They sent me a brief. Oh, I'm so sorry.
A social worker asked me, did I have any physical violence towards a healthcare worker, and I told them yes.
I believe that it's a question that's generally asked of people.
No. I understand the question, but you're saying that they put that I told them yes.
The screening indicates that there is a history towards healthcare workers of violence or aggression.
So I told them that, or they put that there?
That I'm not 100% sure on.
Okay, so in the beginning of the call, she said that a screening was done and that I was asked, have I been physical and aggressive with a caregiver? And then she says, you can barely hear it because I'm talking over her, that I said yes. But then when I ask her again, her response is she's not 100% sure.
Told by risk management that typically it's a questionnaire that's asked of people.
But yeah,
I'm not part of the hospital process, but that's what I was told is that's usually asked of patients. But,
yeah, that's fine.
I was in the room, so I'm not sure what was said or not said.
Yeah, the problem is that is against the law to say that I said something that I didn't say, and it causes problems with other healthcare providers. So I can just look at in my health record, but I just needed. I'm gonna look it up, and if they did put it in
there. Lisa, you can always request. I know that Carmen sent you the last email, I believe, was how to request medical records as well.
No, I don't have to request it. I can just look on my chart, and I can see what was said and stuff like that. But I still want it to be investigated because I know I didn't say it. So I requested a level 1, and I think SSM has 30 to 40 days to respond. And the way that Carmen responded was not protocol.
And, you know, when we take a look at this, like I said, it's a risk management team, you know, we see flags in the chart, right? And that's kind of the extent of what we at intake see. And then the risk management team will look through it and see kind of what the risk factor is, right? There's lots of different things that might affect that for somebody. So that was what flagged the system was on the March 24th. There was a yes indicated that there was a history of violence or aggression towards healthcare workers. And then looking at it further, on that visit, it looked like you had left the ER without medical guidance, so AMA, which that's not necessarily a factor. It may be a factor to being able to provide ongoing care, right? If
what date was that?
It was the same visit, the 24th of March.
The 24th of March of what year?
This year.
This year?
So it would have been last month. Mm-hmm. Yep.
Oh, I remember that day.
Okay. And then I did just want to review the other kind of part of the factor in the decision when our risk management team took a look at the access of the records that we have. And it's from October 2nd, 2024. And it looks like you went to the ED again. I don't know the exact nature of the visit. It looks like that you were not sleeping well, not able to focus, having poor memory, and you've gone to the ER to maybe get help with that. So like I said, I don't have very much information on that visit, but the thing that kind of flagged in the chart was that you had charges for domestic violence and resisting an officer.
I don't have any charges for anything, and that is illegal to put something like that in my medical file. I'm not charged with anything. I'm still innocent, and I'm going to trial.
Okay.
And I'm not sure how protecting myself would have been domestic violence, but that's besides the point. You guys don't know what the story was, and no one cared because no one even looked it up to see if I was actually charged. Is there any other things that you want to add in there?
No, those were kind of the three things in our records that led us to make this decision. We wanted to make sure, like I said, that our staff were safe.
So do you guys?
We have to consider things differently than.
So who red flagged it? Was it the doctor? Because that would be bad.
Well, the documentation says that you were charged. I will say that our risk management team saw that charges were pending, and we understand that there's a difference, right? That, there is a difference in those things.
But no one was hurt. Therefore,
the three things that were in your documents, in the documentation that led us to this decision.
So it was, wait, which one is it? I'm confused. So it was the charges that I'm not charged with?
So the documentation says charge, just for your awareness. Like I said, you can request those documents.
I don't have to request that. I just want to know who put that I was charged with it. Because it wasn't a judge.
Hospital visit on October 2nd, 2024.
So doctors can.
St. Mary's ED.
So doctors can tell you guys when somebody has been charged with something. How do they get that information?
So based on the documentation, it looks like a conversation that you were having with the person that you were talking to.
Now, I just don't understand. Like, was it SSM who wrote that?
Yes, this is part of SSM documentation. So it would have been during your hospital visit, one of the clinicians at the ED.
Was flagged. When did the flag get placed?
So it was from March 24th. So that was your visit last month.
So if I was dangerous and they were using charges that I'm not charged with, then why would they bring it up this year, not last year when it happened? Why wouldn't it be flagged then?
I'm not sure.
Because lying about something that I said or did is defamation. I did not say that. And it was not in the notes about anything dangerous. And then they told me, she said, okay, I can leave. And then she still put in paperwork that I just left out. I have never just walked out of any facility without telling someone that I'm leaving. Do you know why? Because I used to be a healthcare worker. And I don't know about now, but when I used to work with doctors and nurses, if you just walk out, the insurance might not pay. So why would I want to pay a hospital bill? She told me I could leave. But I mean, that has nothing to do with being dangerous anyway, so it doesn't matter. It's just that the lies, it bothers me. But okay, thank you.
Yeah, thanks, Brisha. Have a good weekend.
You too.